They've caused global scandals. They're banned in most athletic competitions, such as the Olympics, professional sports, powerlifting competitions, etc. But are steroids actually bad for you? The term steroids refers to the broad category for molecules that share a similar molecular structure but have many different functions. When people talk about steroids in the context of sports, they're referring to the subset of steroids that resemble testosterone. Though elite athletes and bodybuilders began using these steroids in the 1950s, today most steroid users are competitive athletes, but people with goals to look a certain way, not to perform a certain way. Steroids have two main effects of the body: androgenic effects, which cause masculating, and anabolic effects, which causes a growth-promoting effect, hence why people who take them have big muscles. These effects mimic naturally occurring testosterone, which drives the development and maintenance of male secondary sex characteristics and overall growth. According to MayoClinic.com, testosterone promotes body and facial hair, enlargement of the vocal cords, deepening of the voice, increased muscle mass and strength, and increased structure and bone mass. According to Cleveland Clinic, steroids help your muscles grow and recover faster than a natural athlete. By doing this, they promote protein synthesis. These proteins are essential building blocks of all cells, tissues, organs, and including muscles. Steroids also block cortisol, which is a signaling molecule that sends the breakdown of substances, including proteins. In addition, steroids help push the development of muscle rather than fat and boost our metabolism, shrinking fat cells. These properties make steroids valuable for treating many illnesses and injuries. They also help people with wasting illnesses like AIDS and certain cancers, maintain muscle mass, and help burn victims recover lost muscle tissue. With all this being said, it doesn't sound like steroids are all that bad and seem pretty safe to use, right? Well, there are consequences for everything you do. Like Isaac Newton once said, for every action there's an equal and opposite reaction. To create the desired muscle growth, recreational steroid users must take higher doses than prescribed patients. According to versusarthritis.com, long-term high-dose steroid use can have both undesirable and major harmful effects to your health. Obviously, these factors vary due to age, gender, and sex. Steroid use is risky for adolescents. During puberty, steroids can prompt bones to mature before they're done growing, causing growth defects. Adolescents are also most at risk for the harmful psychiatric effects of steroid use. This includes impulsiveness and increased aggression, also known as roid rage. According to Mayo Clinic, up to 60% of users experience these effects, but there are also less common, more damaging psychiatric effects like mania and psychosis. Steroid use can damage organs including the liver and kidneys, as well as cardiovascular problems like high blood pressure. While some of these effects can be reversible, steroid use can cause liver cancer, but most commonly in males. Though recreational users take steroids for their anabolic effects, they also experience androgenic effects. This can mean body hair, enlargement of the clitoris, and permanent voice deepening in females. In addition, excess testosterone, like steroids, can cause feminization in males because the body will convert the excess testosterone into estrogen. This can lead to breast development in males, also called gyno, and shrinking of the testicles. Unfortunately, these effects are not uncommon. Again, according to Mayo Clinic, approximately 1/3 of male steroid users experience these side effects in some degree, and again varies with age. Excess steroid use can also reduce fertility in males and females by reducing sperm and semen in males and causing missed periods in females. Fortunately, all these effects can be reversible in steroid stoppage completely, but again, there's no chance that it may not. The specific steroid, the duration of use, and other factors could play a role in reversibility. Research has also shown that steroid users experience steroid dependence. This will cause them to develop a tolerance and require increasingly large doses over time. This increases the risk of harmful effects, and the chances of these risks increase the higher the dosage is. There still remains little information on how common and how reversible these harms are at different levels of use due to the fact that steroids can affect everyone, just like cigarettes affect everyone differently. I've seen 90-year-olds who smoke 2 packs a day, while some 30-year-olds already have lung cancer.